I'm Dr. Dawn Bearden from Fort Lauderdale Eye Care and Eyewear, and today we're going to talk about dry eyes. So, do you have dry eyes? What would you feel if you had dry eyes? Sometimes your eyes feel actually dry, and sometimes they don't feel dry. Sometimes your eyes are actually over-watering. Sometimes they feel scratchy, they feel gritty, they feel burning, sometimes they itch. Sometimes your vision will fluctuate, like you have to blink to get things clear, or when you blink, things get blurrier. Like I said, you could be over-watering, you could be tearing, you could have mucousy discharge. Your eyes can be red, and you don't know why. Your eyes can feel tired, especially after a long day or on the computer a lot. Your eyes can feel very tired. You can get light sensitivity. You can get sensitivity with wearing contact lenses. Sometimes the vision is not good if you have dry eyes. If you have dry eyes and you wear contacts, sometimes the vision with the contacts is not really great, because contacts really have to be moist in order to give you the best optics. Sometimes the contact lens, they're not comfortable because your eyes are dry. A lot of times people who have dryness get infections or styes around their eyes, often recurrently. Sometimes people get red, flaky, like lid margins. Their lids are stuck together. They feel crusty around their lids. All of that can be part of dry eye. So dry eye is, a lot of the underlying cause for dry eye is inflammation. So we'll talk about that in a little bit. So let's talk about the actual tear film on the front of your eyes that keeps your eyes nice and lubricated. The first layer of the tear film is formed by the front surface of your eye, the clear part of your eye where a contact lens would sit. That's called your cornea. So that would be right here. So this is your eye, and this part right here is your cornea. So that would be the part that makes the first layer of your tear film. So if you have had a corneal injury or burn or any kind of corneal problem, sometimes you have dry eye because that initial first layer of the tears is not being formed correctly. The second layer of your tears that comes from the lacrimal gland, which is a gland that is right here, and right here. So that is the part of your part of the tears that's the watery part. That's the second layer of the tears. So if you look here, where's your eye, and then you've got this gland right here. It's right here. It's called your lacrimal gland. So that's the part of the tears that's the watery part. So a lot of times when you cry or when you have something in your eyes water, and that part of the tears is being caused by the lacrimal gland. The third layer of your tears is actually an oil layer, and it's formed by if here's your eye, you've got your lids in cross section here, here's your lashes. So right behind your lashes, you've got these oil glands on the top and the bottom. So these glands, when you blink, they express oil onto the front surface of the watery part of the tears. So what that does is it actually creates an oil slick on the outside of your tear film. So it prevents your tears from evaporating. So if you're having problems with the glands either not working, or the glands aren't there because they've died off or they're clogged, then you're not going to get that oil slick, and then your tears are going to evaporate very quickly, and then you're going to get signs and symptoms of dry eye. So again, dryness, scratchy, gritty, burning, stinging, watering, all of that is a part of dry eye. So if I have special equipment in my office, and a lot of dry eye specialists have this equipment also, where we have a piece of equipment that shines infrared light onto the lids. So if I pull your lid down and I shine infrared light and I take a special picture, I can get pictures like this. So the glands that produce the oil are called meibomian glands, and they should be nice and straight. There's maybe 25 or 30 of them on the bottom lid, and if you flip your lid on the top, same thing. So if you have glands that are clogged due to either inflammation or maybe you're not blinking a lot, then the glands can become very distorted. They can become clogged, they can drop out or die, and then as time goes by, you have less and less glands. And then once all the glands are not there, then you have no oil slick. And the minute you have no oil slick, that's when your tears are going to evaporate, and there's really not a lot we can do at that point, because there's no oil slick on the outside of the tears to keep the tears from sticking to your eyes. So again, we can flip the top lid and we can look here and we can see that the glands are supposed to be nice and straight, and then they become distorted and then they drop out and then they just kind of die. So, and that also happens on the bottom as well. So we don't want that to happen. We want to have nice, healthy glands. So again, inflammation can cause this. So a lot of times things that we eat are very, very inflammatory. Things like sugar, things like pasta, white bread. So a lot of that can be very, very inflammatory, and inflammation can make dry eye worse, and dry eye can create your eyes to become inflamed. So you kind of have a vicious cycle of inflammation and dryness and inflammation. So when you blink your eyes, those glands, they actually touch and they express oil onto the front surface of your eyes. So if those glands get clogged, then you're going to have a problem with dryness. So if you have dry eye problems, you need to see an eye doctor, and one that preferably specializes in dry eyes, so that they can figure out, are you not making enough tears? Do you have too much inflammation? Are your glands clogged? What's the problem? And then they can tailor a solution to exactly what your problem is. Sometimes that's a supplement, sometimes it's a warm compress, sometimes it's prescription medication, sometimes it's specialized eye drops. There's a lot of different things that we can do for dry eyes. We see dry eyes a lot in people who are on computer a lot, because when you're on a computer, you have a tendency to not blink. And when you don't blink, the glands don't ever touch and they don't ever express, so that they actually become clogged. So also in women, because of the hormones that women have, and also when we're over 40, things just start to, I guess, break down. So if you're having problems with dry eyes or even watery eyes, or dryness, scratchy, gritty, burning, stinging, tired eyes, see your eye doctor, and especially if that doctor is a dry eye specialist, and they will figure out, do a dry eye workup on you to figure out why your eyes are dry, and they will come up with an appropriate treatment plan for you. Thank you so much, and I'm Dr. Dawn Bearden from Fort Lauderdale Eye Care and Eyewear. Hope this helps.